evaluation and management is a crucial aspect of healthcare that determines the level of service provided to a patient and is used to justify the billing and coding for medical services. Who is responsible for medical decision making? Doctors. They are the main decision makers in medicine. But patients, through informed consent, have the right to be included in decision making process. The patients may agree or disagree with the doctors or healthcare system. MDM requires information from multiple sources, including interprofessional communications. MDM is the process by which a diagnosis or treatment plan is formulated from available test informations, often with incorporation of non-patient preferences. The straightforward, low, moderate, and high complexity decision making are defined by three elements. They are number and complexity of problems that are addressed during encounter, amount and complexity of data to be reviewed and analyzed, risk of complications and/or mortality or morbidity of patient management. Let's see what is number and complexity of problems addressed at the encounters. A problem is a disease, condition, illness, injury, symptom, sign, finding, complaint, or other matter addressed at the encounter, with or without diagnosis is being established at the time of encounter. Even though there is no diagnosis established at the time of encounter, all these are considered as problems. To affect MDM, the problems must be addressed. That means problem addressed or managed when it is evaluated or treated at the time of encounter by physician or other qualified healthcare professional reporting the service. While considering problems, these points must be noted. Comorbidities are not considered in selecting level of MDM unless they are addressed or their presence affects the data to be reviewed and risk of patient management. Extensive evaluation may be required to reach the conclusion that final diagnosis is highly morbid or not. Problem addressed may include consideration of further treatment or testing that may not be elected by virtue of risk or benefit analysis or patient or guardian's choice. If medical record states that another professional is managing the problem without additional assessment or care coordination, doesn't qualify as being addressed. Referral without evaluation or consideration of treatment doesn't qualify as being addressed. For hospital inpatient or observation care services, the problem address is the problem status on the date of encounter that may not be the reason for admission or continued stay. Let's check types of problems. First one is minimal problem. Problem may not require presence of physician or other qualified healthcare professional, but the services are provided under their supervision. If you are analyzing the CPTs 99211 and 99281 to report both these codes, the service doesn't require presence of physician but requires their supervision. Example, suture removal by a nurse. Next is self-limited or minor problems. Problems runs for a definite and prescribed course which is transient in nature and not likely to permanently alter health status. For example, epidermal inclusion cyst and seborrheic keratosis. Next is stable chronic illness, a problem with expected duration of at least 1 year or until death of patient. For example, patient with poorly controlled blood pressure. While categorizing MDM, stable means patient who is attaining his or her treatment goal. In case of patient with poorly controlled blood pressure, he is not attaining the treatment goal, that is the better control, even if the pressure are not changing and the patient is asymptomatic. Acute uncomplicated illness or injury. It is recent or new short-term problem. there is low risk of morbidity, but treatment is considered. With treatment, little to no risk of mortality, and full recovery is expected without functional impairment. For example, cellulitis. Stable acute illness means new or recent problem in which treatment has been initiated and the patient is improved and stable with respect to condition. Chronic illness with exacerbations, progression or side effects of treatment, which is a chronic illness which is acutely worsening, poorly controlled also, and progressing with an intent to control progression, which requires additional supportive care or requiring attention to treatment for side effects. For example, active lesions. Undiagnosed new problem with uncertain prognosis. Here the problem is in differential diagnosis. That means the problem is in a list of possible conditions that share the same symptoms. And that problem represents a condition likely to represent in a high morbidity without treatment. For example, changing pigmental lesion. This may be the reason for cancer, skin infections, etc. So such type of problem is undiagnosed new problem with uncertain prognosis. Acute illness with systemic symptoms. Certain acute illnesses causes systemic symptoms. In that case, high risk of morbidity without treatment. For example, new onset of acute systemic lupus erythematosus, which is an autoimmune disease which affects multiple systems. Acute complicated injury. Injury occurs acutely and it requires evaluation of other body system not directly the part of injured organ. Injury is extensive, requires multiple treatment options, definitely associated with risk of morbidity. Chronic illness with severe exacerbation, progression or side effects of treatment. The chronic illness is exacerbated severely. That means increase in the signs and symptoms or intensity. Or there is side effects of treatment and that side effect of treatment have a significant risk of morbidity and may require escalation or elevation in level of care. Example, SLE with acute diffuse purpuric eruption. Acute or chronic illness or injury that poses threat to life or bodily function without treatment. For example, advanced regional melanoma. The data include medical record, tests and other information that must be obtained, audited, reviewed and analyzed for the encounter. This includes information obtained from multiple sources or interprofessional communications, which are not reported separately, and interpretation of tests that are not reported separately. Ordering a test includes in category of test results, and the review of test results should be the part of that encounter and not on the subsequent encounter. Ordering of tests may include those considered but not selected after shared decision making. For example, a patient may request a diagnostic imaging that is not necessary for their condition and discussion of lack of benefit may be required. Alternatively, a test may be normally performed but due to the risk of specific patient, it is not ordered. These considerations must be documented. Points to be noted while considering amount and complexity of data to be reviewed and analyzed. The data or tests are perceived to be analyzed when results are reported during the encounter. In case of any recurring orders, each new result may be counted in the encounter in which it is analyzed. For example, monthly prothrombin times. It would count for one prothrombin time ordered and reviewed, and the additional future result if analyzed in a subsequent encounter, which will counted as a single test in the subsequent encounter itself. And the tests may include imaging, laboratory, psychometric or physiologic data. The clinical laboratory panel, example basic metabolic panel, is considered as a simple test. And for the purpose of data to be reviewed and analyzed, pulse oximetry is not a test. And unique test. When multiple results of same unique test are compared during evaluation and management service, count it as one unique test. For example, serial blood glucose values. It will count it as one unique test. And the third element is risk of complications and or morbidity or mortality of patient management. It is the risk for patient management and not the risk from the condition itself. For the purpose of MDM, a level of risk is based upon the consequences of problems addressed at the encounter when properly treated. When treated, what are the consequences? That is this element. For example, certain therapeutic agent requires intensive monitoring to monitor adverse effect. Certain therapeutic drug may cause morbidity or death, so it requires intensive monitoring. At that time, we are assessing for the adverse effect, not for the therapeutic efficacy. And another example, in case of insulin therapy, we are monitoring for glucose level. In that case, we are monitoring for the therapeutic efficacy, not for the adverse effect. But in order to be termed as risk or risky, if it needs assessment for the adverse effect, then it is termed as risk. Let's do an example. A 35-year-old female patient is returning to her physician office with complaint of right lower quadrant pain and heartburn with temperature of 100.2. The physician performs detailed history and detailed examination and determines the patient has mild appendicitis, so prescribed antibiotics in hope of avoiding appendectomy. Find out level of MDM. Here they are asking for finding out the level of MDM. So no need to find out whether it is established or new patient, but it is an established patient because the patient is returning to her physician office. And she is coming with right lower quadrant pain and heartburn with temperature of 100.2. After detailed history and examination, the physician determines patient has mild appendicitis. Appendicitis is an acute illness and the patient is having acute illness with systemic symptoms. She is having heartburn, right lower quadrant pain and fever. So she is having systemic symptoms also. Note this point. And the physician has prescribed antibiotics. So there is prescription drug management also. So based on these findings, let's use the MTM table to find out level of MTM. We have MTM table to find out the level of MTM. They are straightforward, low, moderate and high complexity MDMs are there. To find out the level of MDM, check for the 3 elements. Out of 3 elements, should meet 2 elements to find out the level of MDM. The elements are number and complexity of problems addressed at encounter, amount and complexity of data to be reviewed and analyzed, risk of complications or morbidity or mortality of patient management. Among the 3 elements, 2 of them should meet to find out the level of MDM. In our question, there is prescription drug management. Since the physician is giving antibiotics to treat appendicitis, there is prescription drug management and the patient is having acute illness with systemic symptoms. Appendicitis is an acute illness and patient is having 100°C fever and right lower quadrant pain and heartburn. So patient is having acute illness with systemic symptoms. So our 2 criteria met. So the level of MTM is moderate.